Healthcare is uniquely different. I would say it's different from many other industries, in part because it's so heavily regulated. So that's the first thing, is that you cannot put anything out there that is a device or a therapeutic, especially invasive devices or drugs that have not gone through a very rigorous process of assessment for safety, for efficacy. Nowadays, actually, in the healthcare ecosystem, there are specialists, consultants, people that understand regulation that can help entrepreneurs navigate the regulatory environment.
Behind every successful startup, there is usually a messy stretch nobody talks about, the stretch between insight and execution, between discovery and adoption, between a great idea and something that actually works in the real world. That's exactly where today's guest has spent much of his career. Welcome to another episode of School to Startup, brought to you by Traction, a private market intelligence platform that's been supporting the global university ecosystem for over 12 years. Through our university partnerships, we work with institutions driving innovation and entrepreneurship, and this series highlights the academic leaders making it happen. I'm Harish, your host today, and today's guest is Dr. Phillip, Alonzo and Virginia Decker professor at Johns Hopkins Carey Business School in Baltimore. He sits right at the intersection of research, medicine, innovation, commercialization, and the very messy reality of turning brilliant ideas into something useful in the world. Dr. Phan, it's a pleasure to have you with us.
Thank you, sir. Call me Phil.
All right, Phil. So, to start us off, can you tell us a bit about your journey? What first pulled you into academia, innovation, and entrepreneurship?
Yeah, so I started this journey about 35 years ago. My first exposure, so I was doing my PhD in applied economics at the University of Washington. And the very first project I got involved in, interestingly enough, was with a couple of faculty members who were studying the wine industry in the Pacific Northwest. At that time, back in the late 80s, the Pacific Northwest in the United States wine industry was just up and coming. It had a little bit of, I would say, a second mover to the California wine industry, which is, of course, very, very huge today. But we were very interested to understand what is it that made these entrepreneurs. We called them entrepreneurs at the time, but it turned out that they were probably more like hobbyists. And we wanted to understand why they got into this business because this is a very tough business to be in. I mean, in any kind of an agriculture business, you are exposed to risks that you basically cannot control. So in agriculture, the way you deal with risk, the way you mitigate risk is that you have to buy insurance. So if you're a big agricultural company, you can either buy insurance from a commercial insurer or you can insure yourself. But if you're a small family firm, you're pretty much at the mercy of the elements. That's one. The second thing is that something like, unlike, corn or wheat or rice, the sort of staples, when you're talking about grapes and wine, um, you're also dealing with the risk of things like trends, tastes, fashion. And that's also something that if you're a small producer, you cannot really, control. And so in any case, we were very interested in understanding why people got into it because these risks were very high. The odds of failure are also very, very high. You're not producing something that people actually need, is something that they might want. And so that's sort of how I started. And I started trying to understand the mindset of the entrepreneur. Why do they take risks when nobody else would? And as I said, at least in that particular industry, it turned out they were really more passion driven. Many of them were hobbyists. They may have made their fortune somewhere else. Some of them may be inheriting a family business and felt they had to continue because of legacy, etc. So that's basically what got me into this, into this business of understanding entrepreneurship, why people engage in risk taking, how do they innovate, how do they understand, innovation relative to, producing something that, they might see as an opportunity, but maybe it's more of a me too. So, and in any case, that's sort of the beginning of the journey, and of course, it has evolved, very much since then.
Very interesting. A lot of startup conversations sound exciting until healthcare enters the chat. Then suddenly there is a regulation, trust,
Hmm.
patient outcomes, reimbursement, hospital systems, and 10 other committees, right? So, what makes healthcare innovation uniquely difficult to commercialize? I'm asking this because I see you have a lot of work done in this particular sector.
Yeah. So that's it's a good question. When I started looking at entrepreneurship and innovation and technology, I wasn't in healthcare. So for the first 20 years of my career, I was focused on other things. And then, when I joined Hopkins about 15 years ago is when I started looking very seriously at healthcare. And healthcare is uniquely different. I would say it's different from many other industries, in part because it's so heavily regulated. So that's the first thing, is that you cannot put anything out there that is a device or a therapeutic, especially invasive devices or drugs that have not gone through a very rigorous process of assessment for safety, for efficacy. Every country has its standards. That also makes it somewhat interesting because it's not so easy to scale healthcare innovations, right? Each time you move to a different setting, a different country, you have to comply with those regulations. So that's one. But actually, the more important part, I feel, because you can deal with the regulatory environment if you are set up for it. And nowadays, actually, in the healthcare ecosystem, there are specialists, consultants, people that understand regulation that can help entrepreneurs navigate the regulatory environment. But I think what is particularly interesting about healthcare, and that's the case regardless of where you are in the world, is that the customer and the payer are oftentimes different people. So if you're talking about things like prescription drugs or invasive devices, your customer, you have multiple customers, right? You've got the patient, obviously, that needs these things. You have the clinician, the doctors that prescribe it, that use it, that recommend it. But more importantly, the entity that pays for this are not the patients and the doctors. They're oftentimes the insurance companies, the Ministry of Health. Sometimes it's the hospital itself if it's part of a service package. And so, as an entrepreneur, you have to deal with all of these stakeholders simultaneously. So you cannot, for example, design a drug or a device, or even an app, right, for a patient without also simultaneously considering if this is something that will be paid for. How will it be paid for? How much will it be paid for? Because in a lot of jurisdictions around the world, even in the US, which probably has the freest healthcare market in terms of how things are paid for, even in that situation, there are limits to how much a payer is willing to pay. And so you sort of have to design your solution with all of these constraints in mind. And that's a tough challenge, right? It's a tough technological challenge. It's a tough marketing challenge. Even conceptualizing the nature of the problem itself. What is your minimal viable product? What can you go to market with that could potentially be attractive, but not designed in such a way that it's economically unsustainable. Those things are present in one way or another in other industries, but in healthcare, they are there in spades. And as I said, it's a multi-pronged, multidisciplinary problem that is very difficult to solve for a single individual. So if you look at the way technologies are are introduced into the market in healthcare, they're typically done, by teams, and some of these teams are massive teams. So an idea may start with an individual, but in order to turn that idea into something, that can be used in the bedside, it's a long journey. It's, every step along the way is a failure point, whether it's the initial animal trials all the way through to first in human to clinical trials. But more importantly, even if you're able to take something to the marketplace, if you're able to instantiate the idea in a product or a therapy or something like that, there's no guarantee that it will succeed, because there's no guarantee that doctors will adopt it, that patients will use it or agree to use it. So it's very high risk, for that reason, which is why it's so costly to innovate in healthcare.
Very interesting. Zooming on to JHU, Johns Hopkins is one of the world's most research-driven institutions. How does it foster a culture of, entrepreneurship and support faculty and students in bringing ideas to the market?
Yeah, so I would say, if you think about any particular single institution, right? Hopkins, for most of its history, and I think even up to today, is the largest recipient of fundamental research funding in the world, right? By far. I don't know what the numbers are today, because they keep changing, but until last year, Hopkins receives roughly about $2 billion in fundamental research funding, from various sources, primarily from the US federal government. So it far exceeds, most any academic institution. And so I would say that for the longest time, the need to commercialize its discoveries, and there are many, has not been great, because you had a very stable, very rich source of funding. It was only maybe about 10 years ago that the university began to feel the effects of declines in funding, at first gradually, and then the declines accelerated, because there were basic questions about what was the purpose of fundamental research funding. And these questions were coming from taxpayers, right? So, it's great to discover, a new, biological pathway that, can potentially, cure Alzheimer's or something like that. All right. I mean, Alzheimer's is not, we don't actually have a good therapy even today for that. But let's say that you found something, fundamental. The cost of translating that into a viable therapy is high and multi-years, and it's not something that taxpayers necessarily are interested in funding, only because the outcomes are so risky. So so there is sort of this fundamental question, like, should we be funding basic research, or should we be funding applied research? Now, I would argue that that dichotomy is somewhat artificial. I don't think that you can translate anything if you haven't discovered anything yet, right? One depends on the other, but nonetheless, the institution itself began to feel the pressure of questions and decline in funding for basic research, and so it turned its attention to commercialization, because commercialization potentially, even though it's highly risky, it's potentially a source of revenue that would support its academic, research mission. And so maybe I would say, what did I say, 10 years, 15 years. So 15 years ago, the president of the university, who was new at the time, decided that we really need to pay attention to technology commercialization. And then began to build the function of the technology transfer office, hired people that could basically change its mission from simply, patenting and licensing to business development. And now the university is among the top 20. Before, I think it was like ranked almost last, for large universities in the US for commercialization. Now it's within the top 20 or 25. I mean, the numbers change from year to year. So for a very short period of time, for the amount of time that it had to accelerate commercialization. I would argue it's probably one of the most successful right now in the world. I mean, there are many universities that try it. Very few have, gotten to this point so quickly for two reasons. One, it has a very strong fundamental portfolio of basic discoveries. I mean, you have to start with something, right? So if you're a university that has very little, I would say, research to begin with, it's hard to do this because you don't have the ingredients to work with. So it had the advantage of 150 years of basic research, many of which have been attributed to Nobels that have come across. Hopkins is also the only institution, I think, no single institution that has as many Nobel Prize winners, as I think they're like 37 or 38 now for one institution. So you have good ingredients. So as a university, you got to think about what are your basic ingredients are, right? What are you good at? Agricultural science, healthcare, biomedical science, engineering, what have you. And you can define it as broadly or narrowly, as you feel makes sense. Then the second thing is, frankly, they invested, right? They invested, you have to invest. So they put money, lots of money into developing, first into hiring people who understood not just a technology or not just the legal aspects of technology like patenting, but people who understood business. They understood product development. They understood how you work with companies that are interested in using your knowledge in their innovations. So that requires money. You have to hire people. The returns of the effort are not immediate, right? They have to work. It's like sales, right? If you think about it, you hire a salesperson, it takes a while for the salesperson to figure out, especially if it's a new market that they're in, how to work the market, who the major players are, how do you negotiate with them, what their interests are, what makes them excited about what you have to sell. It's sales ultimately, right? Combined with a very heavy dose of engineering, medicine, understanding of those basic science technologies. And so you can't find this in a single individual. You have to build a team. So that's what they did. The other thing was they created the infrastructure, or we created the infrastructure to support uh, graduate students, undergraduate students, faculty who were interested in commercializing their technology. That meant two things. Number one, you had to have money to support them, seed money, right? Because getting research funding for basic science is one thing. Getting research funding for translating that science into something that could potentially be useful is another thing. And the sources of funding are not the same typically, right? Even in the US, where the National Science Foundation or the NSF or even the Department of Defense, they do have funding for commercialization. Is tiny. It's about 3.2% of total funding that is given for basic research. And so so you have to find sources of funding to support these experiments, which most of them are not going to create a return, right? I mean, that's the nature of experiments. Maybe 1 in 10, 1 in 20, right, can move on, to the next stage. So this is very high risk. That required also developing an ecosystem where you have supporters, alumni, perhaps angel investors, people who understand risk taking, are willing to take risks, are willing to invest in these high risk ventures, with the small hope that it could actually result in something. So that's a very special kind of stakeholder as well. They exist, but you have to look, you have to find them. And they're oftentimes not necessarily motivated by money or profit. They're motivated by a mission. They want to solve Alzheimer's. They want to solve diabetes. They want to solve the energy problem. Whatever the case may be. So you got to look for them. So they had to build up a sort of a donor development function as well, which is separate from technology commercialization. And then many of these funders were also asked to support the creation of incubators and accelerators. So the university itself started with one accelerator, and now it's got I think, four accelerators in different domains in software, in biomedical science, in engineering, etc. So, and all that within the last 15 years. So I think that's the key. And ultimately, the real important thing is you need to have commitment from leaderships, right? So the president was pushing this very hard because he could see, you see down the road and you see a cliff in terms of research funding. So you have to replace that research funding. But more importantly, I think the leadership has to be motivated by like a long-term vision of what a university is supposed to do, right? Most university leaderships, I feel, are still sort of stuck in this idea that, well, we just do teaching and research, which is great. I mean, that is the fundamental purpose of the university. But nowadays, I think universities are being asked by society, especially if you're a public university that taxpayers are funding, to do more than that, right? So yes, teaching and research, but what does that amount to, right? Yeah, training students so they can be productive in the workforce. We understand that, but there are many ways of doing that. You don't need a university to do that, frankly, right? YouTube can do that. I mean, you may have heard of the Khan Academy, right? There are many modalities. So the university nowadays, right, has to be able to make a stronger case for its existence. And part of that is societal impact beyond just training people, for the workforce, right? Beyond simply just creating knowledge for knowledge's sake. It has to amount to something that people can see and touch and feel, and more importantly, benefit from. And so I think, that's a big mindset change. I'm not sure that many universities are prepared to do that because when you go in that direction, then you're also sacrificing other things, right? For the university to do this, it has to free up resources. So maybe it cannot, have as many administrators as it might like. Maybe it's going to require the professors, to carry a heavier workload so that resources can be freed up for other things, that are important, relative to its societal mission, the university societal mission. And those are tough. Frankly, academics hate to make change. I mean, regardless of the fact that we're supposed to be innovators, we hate to make change. We hate to give up the toys that we think we work so hard for, which is, free time and, etc. Right? So I think, I guess what I'm saying is, in order for what the university has done is not just building infrastructure, not just hiring and building human capital to support, its mission towards technology commercialization, entrepreneurship. It also had to go through a period of cultural change in which mindsets are shifted, and the people who are truly excited, about the possibilities of entrepreneurship, are leading the university. And that was probably the toughest part for a university that has traditionally existed very, very well for 150 years on research funding. It still does, but it's much less now than what it used to be. And so, you have to do all this, and you still have to maintain the quality of the research and the academic standards that befits a university like Johns Hopkins. So that you can't give up, right? So on the one hand, while you might have to free up resources to support these other things, the one thing that you cannot give up is academic rigor, excellence in research, because as I said, those are the feedstock to innovation. If you don't have that, if you don't have excellent fundamental research, world-leading fundamental research, basic research, you don't have the ingredients to do commercialize. Like, what are you commercializing, right? Very little. So it's a tough challenge, but it can be done. And I think at least at Hopkins we've shown that it's doable.
Very interesting. You answered most of my questions today.
Sure.
So, for students watching this, those interested in startups, innovation, research, or commercialization, what would you encourage them to start doing now while they are still inside the university system?
Well, most of us walk around with problems in our brains, right? I mean, when you just go through the day, just living your life day to day, you run into problems. All of these problems are potential opportunities, right? There's really no such thing as a problem. It's basically, something that hasn't yet been solved. And the solution to a problem, if the problem is big enough, meaningful enough, represents an economic opportunity. So what I would say is, for students that are, interested in exploring entrepreneurship, is to think about your most vexing problems and to think about whether there are solutions to the problems. They may already exist that you don't know about. Most of the time, those solutions may not be as exquisite or as precise as you would like, and so those represent opportunities for innovation. The other thing too is that I would spend a lot of time doing productive networking. By productive networking, I mean talking to people from other disciplines, from other schools, other departments that you might meet in your day to day and talk to them in the context of solving problems, right? I mean, the good thing about kids nowadays is that they're really good in social media. I mean, they live in social media. But social media can be useful or it can be sort of a waste of time. I mostly think most of it is a waste of time. That's my personal opinion. But I think it can be extremely useful if you're able to use that platform in order to meet people who come from different backgrounds with different training, different disciplines, different experiences. Because as I said, most successful entrepreneurial startups nowadays very seldom can be implemented by a single individual or people from the same. You need multidisciplinary, teams to solve the problem. So get involved, in student activities in which you are more likely to meet students from different places of the university. And then I think what I've seen among the students that I have mentored is just do it. I mean, it sounds sort of simple, but there is a barrier to just doing it, right? You're taking a risk. Oftentimes, you are facing the possibility that you could spend a lot of time working on something and it doesn't amount to anything. But that's a risk that you have to take. I mean, there's no other way around it. So I would say, just do it. There are obviously classes and courses within the university that can support these kinds of things. But what I've found is that oftentimes the most successful entrepreneurs learn by doing. You know, can you learn how to write a financial statement? Yeah, sure. I mean, can you learn how to put together a marketing plan? Yeah, sure. But, I mean, truth to tell, you can learn this from YouTube. Okay. You don't need, I know as a professor, it's weird for me to say that, but you don't actually need a formal course to do that. What you need is you need to do it. Because as you're doing it, you learn what you don't know. And then what you don't know, you fill up. If you're motivated enough, you could go figure out how to do it. Right. And then again, I think today the opportunities are so great because you have a tool that did not exist before. And of course, I'm talking about artificial intelligence, right? So the ability to learn how to do good prompt engineering allows you to pick up the skills and the knowledge and the research you need in order to do a lot of the initial de-risking, the sort of exploratory work. Of course, you have to understand the risks, and we all know what those risks are, psychophancy and hallucinations and all that. But there are ways to solve with that, and again, you can actually learn how to do that. But you have a tool that can become your co-pilot, not to use, I guess it's a branded term. I mean, like literally, it is what it is, right? It's a co-pilot. It's an assistant to help you think through your ideas. Um, and I think because of that, the possibilities of very interesting innovations and inventions are even greater than they have been before. Your ability to iterate, to do red teaming, meaning to have an opposing view, right, of your most optimistic scenarios. I mean, those things exist now, where before it's tough to find them. So I would encourage students like just do it, right? you don't know what you don't know until you do it. I mean, literally, that's
Correct.
what I tell my students. And then if you need help, that you're in a university or a college or even a high school, you have professors that can help you. And you might not all professors are going to spend their time, I think, mentoring students, but that they do exist. I mean, I'm one, they do exist. And there are many, many faculty members that are excited about seeing their students do something, with their education, like in a very concrete way. And so it's just a matter of knocking on enough doors and finding mentors that will help you through this process.
Amazing. This was incredible. Thank you, Phil, for being part of this episode. I know 30 minutes is not enough to capture all your wisdom and experience that you are carrying. But thank you for being part of this episode and for sharing such a thoughtful insights on entrepreneurship, innovation, and commercialization. Thank you very much.
Thank you, sir.
Great.
Take
So
care.
today's conversation showed us that the journey from school to startup is not just about ideas, it's about turning knowledge into a real world impact. And to everyone watching, please like, comment, subscribe, and click the bell icon for more episodes. See you in the next one.